If you are over 60, your doctor may come across you one day and adjust surgery. At that moment, you might feel like you have no option. Here is what most patients are not told. Some commonly suggested surgeries for older adults have serious risks. These risks can be life-changing, and many top surgeons now wonder if they should be done on patients over an age. Today, we will look at 5 surgeries often suggested to seniors. Research, data, and top medical experts say these surgeries may cause harm than good. This is not about being scared. This is about knowing the facts. In medicine, the dangerous phrase is, "It is routine." Stay with me, because this information could save your life. Or the life of someone you care about. Number 1, heart surgery. Coronary artery bypass grafting in frail seniors. When an older patient has big blockages in the heart arteries, doctors often say that bypass surgery is the best option. This means that surgeons will open up the chest and stop the heart and change the way blood flows by using vessels from the leg or chest wall. For healthier patients, this surgery can be a lifesaver. But for seniors who are over 75 years old, especially those who are frail and have diabetes, kidney disease, or have trouble breathing, the situation is very different. Some studies in the Journal of the American College of Cardiology show that frail elderly patients who have coronary artery bypass grafting face a risk of dying during or after the surgery as high as 10 to 15%. For those who survive, they often have problems with their memory and thinking, which can be permanent. Here is something that your cardiologist may not tell you. For seniors with coronary artery disease that is not getting worse, taking medications, changing your lifestyle, and having smaller procedures like stenting can work just as well with much less risk. Before you agree to have heart bypass surgery, you should always ask, can I have a less invasive option? What does my frailty score mean for my risk of having surgery? Number 2 is spinal fusion surgery for back pain. Back pain is a problem for a lot of older people. When tests show that the spine is worn out and the discs are collapsed, or the spinal canal is narrow, many doctors who specialize in bones will suggest spinal fusion surgery. This is an operation that connects 2 or more vertebrae together using metal rods, screws, and bone grafts. It sounds like this surgery will fix the problem for good. The truth is that it may not be as great as it sounds. An important study in the Spine Journal found out that spinal fusion surgery does not work better than physical therapy and pain management for older people with bad discs. This is true after 1 year or 5 years. This is more worrying for older people. Spinal fusion surgery can be very dangerous because it uses anesthesia, which can weaken the immune system. This can lead to pneumonia, blood clots, and urinary infections. The surgery itself can take a time, 4 to 6 hours, which can be very hard on the heart and kidneys. Here is something that older people should think about. Up to 20% of people who have spinal fusion surgery need to have another surgery within 5 years. This is because the spine can get worse above or below the part that was fixed, which is called segment disease. So if your doctor says you need spinal fusion surgery, you should get an opinion from a physiatrist. This is a doctor who specializes in medicine. You should do this before you decide to have the surgery. Number 3 is carotid endarterectomy in asymptomatic patients. The carotid arteries are on both sides of your neck. They carry blood to your brain. When doctors see a blockage in one of the carotid arteries, they often suggest a carotid endarterectomy. This is a procedure where doctors open the artery and remove the plaque. This surgery helps people who have had a stroke or a mini stroke. It can be bad for older people who have not had any stroke symptoms. Doctors are now suggesting this surgery for people who do not have any symptoms. They have a blockage in their carotid artery. They have never had a stroke symptom. Some research in JAMA neurology shows that older people who do not have symptoms are at risk of having a stroke during the surgery. This risk is the same as the risk of having a stroke in the next few years. This is especially true for people who are already taking blood thinners and cholesterol medications. The American Heart Association says that taking medicine may be the treatment for many people with carotid stenosis who do not have symptoms. So if you have never had a stroke and your doctor wants you to have this surgery, because of an ultrasound, you should ask questions. You should ask if taking medicine is an option. Your life may depend on it. Number 4 is aggressive cancer surgery in advanced age. When a senior gets a cancer diagnosis, fear takes over for the patient, the family, and even the doctor. This fear often makes people rush into the aggressive cancer surgery option available, such as removing the tumor, taking out an organ, or dissecting lymph nodes. Cancer surgery for seniors over 80, especially for slow-growing cancers like certain prostate, thyroid, and early-stage colon cancers, is a different story. In this case, more cancer surgery often means pain and problems for the senior, not a longer life. An important study from the New England Journal of Medicine found that for early prostate cancer, a big operation to remove the prostate did not help older men live longer than just keeping a close eye on the cancer. The operation did leave many patients with permanent problems, such as not being able to control their bladder and having sexual problems. These problems made their life very difficult. Something similar happens with operations to remove part of the colon in elderly and frail patients. In emergency situations, the risk of dying in the hospital can be then 15%. After the operation, older patients are more likely to have complications, such as leaks, blockages, and infections. Before agreeing to any cancer surgery, every senior should talk to a specialist who knows about aging and cancer. That doctor can give them an idea of whether cancer surgery will really help them live a longer and better life, or if it will just make them suffer more. Number 5 is knee replacement in obese or medically complex seniors. Knee replacement surgery is very common in the United States. For the patient, someone who is healthy, active, and not very overweight, it can really improve their life. But for seniors who are obese and have diabetes that is hard to control, heart failure, or poor circulation, total knee replacement can be a very bad idea. Here is why. When patients have a BMI over 40, their knee replacement implant is more likely to fail. For patients who have high blood sugar, and the risk of a serious infection is 3 to 5 times higher. This kind of infection can lead to the implant being removed and permanent disability. Also, knee replacement requires months of physical therapy that many medically complex seniors cannot do. Also, blood clots are a leading cause of death in the weeks after knee replacement. Older patients who take medications have to manage blood thinners, which can be dangerous. The orthopedic surgery community is starting to say that many knee replacements are done too quickly. They think that other treatments like injection therapy, physical therapy, bracing, and weight management can help many seniors avoid surgery. These treatments have helped thousands of seniors with results. The knee replacement patients need to be healthy, active, and not significantly overweight. Knee replacement has risks for obese or medically complex seniors. Knee replacement requires therapy. Knee replacement has risks of failure, infection, and blood clots. Here is what I want you to remember from this video. Surgery is not always bad. It saves lives every day. Surgery is also a business. Hospitals have targets. Surgeons have their ideas. And patients. They are often scared and trusting, do not know what to ask. So here are 4 questions to ask before agreeing to surgery. What happens if I do not have this surgery? How does this condition usually progress? What are all the alternatives to surgery? Have they been tried? What is my surgical risk given my age, health conditions, and how frail I am? You have lived with your body your life. It deserves decisions, not ones made in fear. If this video helped you, share it with someone you care about. Subscribe for health information that your doctor may not have time to tell you. Leave a comment below. I want to hear from you.